Hey guys, it's Dr. Rod here, and I want to talk about a very interesting case I had at the clinic the other day. So a patient of mine walks in. What I noticed is there was a huge abscess right in top of his tooth right here. You see that? When a patient has an abscess, that's a sign of an active infection happening and must be dealt immediately, because that infection can actually travel to other parts of your body, causing a lot of damages. When I first saw this case, I was very intrigued because most of the time infection actually starts from the tooth itself. So when we get a cavity, the cavity travels all the way inside the tooth and infects the tooth itself. But it seemed like the infection was starting from the outside, which is the gums, which a lot of us neglect and don't watch out for, and it traveled all the way inside the tooth. And because of this, the tooth became non-savable. We had to actually extract that tooth. When we extract the tooth, we have to find a solution to replace it. And in this case, we're fortunate enough to be able to place an implant as part of the treatment, which is the best option we have. But unfortunately, because of the active infection present, we can never place an implant the same day of an active infection, which makes the whole treatment a lot longer than normal. Instead of being able to take out the tooth and place an implant, we have to take out the tooth, place bone graft, and wait for it to heal. You can see that there is so much bone destruction right in the middle of the tooth, causing no other option but to actually take it out. We went ahead, placed bone graft, and waited 4 months for it to heal. So now that the bone graft healed 4 months later, the patient was ready for the surgery. The first step what we had to do is numb the patient, make sure the patient is nice and comfortable. What we need to do is open the gums, right? That allows us to see how well the bone has integrated. It gives us a visualization about the size of implant that we want to place. The first thing we do is we place a safety drill. This drill is able to help us gauge how long the implant will be. Once we take an x-ray and confirm the length of the implant that we want to place, we go ahead and increase the size of the drill to help accommodate for the larger implant that we can place in this area. Once we're able to create the exact dimension of the hole that we need to use to place the implant, we go ahead and place the implant. And this is the video of us placing the implant on this lovely patient. This step is very important because we want to make sure the area is nice and flat. We're placing the implant at the right angle and making sure that we don't destroy any other tooth nearby. Ideally, we want the implant to actually torque out a few millimeters above bone level. That tells us that the bone is very strong and all those bone graft that we placed months ago has really integrated super well. And this is a critical step because a lot of time the bone doesn't integrate as well as we would love it to. And in this case, we can see that the implant is actually 3 millimeters above the bone, and we can actually hand torque it right into the perfect orientation that we want it to. So this was a long journey for this patient. I'm very happy that the outcome turned out very well and the bone integrated smoothly. The moral of the story is that infections are not always caused by cavities, but they can actually stem from outside the tooth, the gum area. So that's why it's really important to floss, come to your cleanings every 6 months, making sure your gums stay healthy, because not only are we looking for cavities, we're actually looking for gum disease.